It is estimated nearly 20 million American adults are living with depression.
All new at 6, KV's Jim Bergamo here now to share one Austin woman's battle with the illness and how technology is finally giving her hope. Very interesting, Jim.
Hi there, Tyler, Terry. Well, until now, doctors have relied almost exclusively on medication to combat depression. But at times, that can be either ineffective or worse, have negative side effects. Now, a new device claims to allow doctors to target the exact areas of the brain affected by depression.
It brings fear with it.
For more than half of her 77 years, Bonnie Smith has dealt with a serious illness.
Just a free-floating depression and free-floating anxiety.
Smith says she's seen doctor after doctor and taken numerous antidepressants, but hasn't been happy with the medication's results or the side effects.
I would do okay for months and even several years, and then it would creep back in again.
It may take us a few minutes.
That's when Smith found psychiatrist Marilyn Vaché and the NeuroStar TMS device.
We can actually map the brain with this machine, so we know what areas we're affecting.
TMS stands for Transcranial Magnetic Stimulation. Watch as Vache is able to position the device over the patient's head to trigger a slight thumb twitch.
All right, we located it. From there, we have to move the coil 5.5 centimeters forward towards the forehead.
Vache says that's the area studies have shown where depression symptoms are generated. The treatment coil then sends a pulsed magnetic field, about the same as that used in an MRI, a couple of centimeters into the brain.
When that magnetic field hits the wet tissue of the brain, it turns into a tiny, tiny current that targets only the areas affected by depression. That means there are no side effects. It doesn't go to any other part of the brain, so there's no memory loss, no fogginess.
Vache says most patients require 20 to 30 half-hour treatments.
Oh, absolutely. I was skeptical, but I was so miserable that I was willing to try it.
But Smith says she saw immediate improvement after just 4 treatments. She's undergone 12 total.
And at the end of the 12th session, gosh, I was Bonnie again.
Dr. Vache is one of 3 clinicians here in Austin to offer the NeuroStar TMS treatment, and she says costs are expensive. They can vary from about $300 to $500 a treatment depending on what clinic you choose. She says the good news, though, is that more insurance companies are starting to pay for at least a portion of the cost. Tyler, Terry?